around the upper arm, including the armpit. And you notice that she's made her mitt there. Then covering it up to provide privacy and keeping her warm, rinse out that washcloth from the soap that has been applied, and rinse the arm thoroughly. Lots of times patients have excessive use of soap, and as a result it promotes a lot of skin dryness. So limit the amount of soap that's used, particularly in elderly people. Dry the arm well. You notice how well she's drying the arm and underarm as well. Afterward, lotion can be applied to the arm. In addition to lotion, sometimes patients will have deodorant, or your facility will have a deodorant, or a powder that could be used if the patient would like. Next, you're going to want to wash the hand, and the hand gets washed separately. And sometimes the hand can fit directly into the basin and make certain that it's over the basin. This is particularly good for people who are arthritic, and it helps relieve some of the achiness of those joints in the fingers and hand. It also softens up the nails, and if you're going to be doing nail care, which you would do at this time, it will allow the dirt from under the nail to be softened. And if you're going to be using a clipper and clipping the nails, then it makes the nail tissue itself a little bit softer to work with. Just a little bit about clipping nails. There are some restrictions for clipping patients' nails. So be certain to check with your facility whether or not on this particular patient this is something that you should be doing or not. There are instances sometimes the patient may be on blood thinning medication, or it could be that they're diabetic. Sometimes in with those people, the nails are not to be clipped by a nursing assistant. Now that the far arm and hand have been washed, rinsed, and dried, now the towel is moved to the opposite side, the near side of our caregiver, placed underneath the arm, and folded up around the patient's arm while the caregiver gets, again, washcloth, places into the mitt fashion, and then washes after she applies a little bit of soap to that. During the entire time that a bath is being given, it's important to have the patient's assistance as much as possible. Independence is something that we want to foster with patients. Also, range of motion is something that we want to encourage. And so whenever the limbs are moved, be thinking about the range of motion activity that will keep those joints limber and functioning properly. You also want to carry on a conversation with your patient as you're bathing them. You can find out lots of important information from patients as you're giving their bath, and it's important to focus on the patient and a conversation about them, how they're feeling, their family situation, fears that they might be having, as opposed to focusing in on you. And certainly if there's any significant things that you feel that the patient is stating, if they hadn't slept well the night before, if they're having pain, be sure that you get that information reported to the nurse as soon as possible when your bath has been completed. Now the patient's arm and hand have been washed, they've been rinsed and in the process of drying and tucked back underneath the bath blanket. The next thing to be done is the chest gets washed. and you notice how the caregiver is placing the bath towel over the bath blanket, and then the bath blanket gets lowered to the waist level. This will provide for privacy again, and even though this can be a little bit uncomfortable for the patient to have a caregiver washing their chest area, particularly females, the breast area, as you make it matter of fact and help the patient feel comfortable with it, they will become more at ease as well. You notice that she's providing privacy, but at the same time she's observing the chest area. And you would want to be noting any rashes the patient might have, any discoloration. Sometimes breast tissue, when it's raised, has a reddened area underneath it. That's not normal, and it needs to be reported to the nurse at once. There can also be some lumps that might be felt. Anything that is abnormal, you would certainly want to make note of. Then the chest area gets rinsed and dried off, and patting is better than rubbing too vigorously and making it uncomfortable for the person. After the chest area, then the abdomen has also been washed as a part of this procedure. The caregiver followed that with the lower part of the below the breast area and down to the above the pubic line. The side rail now needs to be put back up and fresh water obtained. Lots of soap and in the water and the soiling from the patient's skin require you to change the water frequently. Exactly how frequently to change the water is rather individual, but it could be more often than we are demonstrating here today. But certainly you would want to not change the water any less frequently than we're showing. Again, the water is about 105 degrees. The side rail then can remain up on the upper portion of the bed because the attention is now being turned to washing the legs. The legs get washed in much the same fashion as the arms did. By that I mean the far leg, or the more distal leg, gets washed first. And again, it's for the reason you're not going to want to be washing over a clean area. And the towel gets placed underneath the leg and wrapped around the individual for privacy and warmth while the mitt is being made. Now the leg gets washed, and you notice the caregiver flexes the leg. Sometimes patients can help with that, but if they can't, it's a good idea to plant as much as possible the heel of the person's foot so that it makes it easier for you to be able to support the leg and wash it at the same time. If there's going to be dryness of skin, lots of times it's the legs that tend to be drier than any other portion of the body. Again, while you're washing every part of the body, you want to do some range of motion as well as observing the entire time that you're working on a part and continuing to converse. You notice how she's patting the leg as opposed to rubbing or massaging it. That can cause some harm for people that are bedridden, so important to just pat the leg dry or any body part. Now the foot itself is going to be placed in the water, and